Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is COVID-19 World News brought to you from Houston, Texas. This is May 22, 2020, and as of May 22nd, there are more than 5.2 million cases of coronavirus all across the globe, with a death toll exceeding 335,000 patients and 2.098 plus million people who have recovered from the coronavirus. This coronavirus pandemic, which started in the early part of January in Wuhan, continues to ravage all across the globe from almost more than 191 countries. We are going to look at the daily number of cases all across the globe, and you will be shocked to see that the number of cases across the globe have been progressively going up since January 22nd or thereabouts. It peaked around April 1st, and as you can see, we are almost at the third week of May, and there continues to be a relentless increase in the new cases all across the globe. On April 25th or so, it reached 100,000 new cases, and in the last 2 days, the number of cases have again peaked at more than 100,000 cases per day. I'm talking about more than 100,000 cases across the world per day. Now let's look at what are the countries that are leading in this coronavirus pandemic. Of course, the United States has more than 1.6 million patients with active coronavirus, accounting for more than 96,000 deaths. We are almost approaching 100,000 deaths. The number of deaths based on a million population is 291. Unlike some of the media which may be misrepresenting the American death rate as 30% of the mortality in the world, actually the mortality in the United States is 291 per million population. There are other countries like Spain, Italy, France, which have a much higher mortality, ranging from 432 to 598 deaths per million population, including UK. You can see their mortalities are much higher than that of the United States. One of the exceptions is Germany in the EU countries, where it has the lowest incidence of mortality. It has 99 deaths per million population. Germany has been most successful in containing this coronavirus in the European countries. We are also seeing a significant uprise in India, with the number of cases recorded at more than 118,000, with 3,500 plus deaths. If you look at the total number of tests done all across the globe, United States has done more than 13.4 million tests compared to the rest of the world. Russia is also leading in the number of tests done at 7.8 million cases. Now let's look at the United States in particular. As I already mentioned to you, the United States has more than 1.6 million cases of coronavirus, with deaths approaching almost 100,000. More than 382,000 people have recovered from the coronavirus in the United States. If we look at the various states within the United States, New York City is leading with 366 plus thousand cases of coronavirus, with its mortality at 28,800. New York accounts for more than 30% of the deaths in the United States resulting from coronavirus. The death rate in New York State is 1,485 per million population, whereas in Texas, the death rate is 51 per million population. But nonetheless, the Texas numbers are steadily rising, and they have not shown any sign of regress at this time, and we'll talk about that. Another important place to remember is Massachusetts, which has shown a significant decline in the number of cases, but still its mortality is 892 per million population. Now let's look at the New York City, which has been the epicenter of the coronavirus pandemic 2020 in the United States. As I already mentioned to you, New York City has more than 366,000 cases of coronavirus, accounting for almost 29,000 deaths, with 63,000 having recovered. And if you look at the graph which tells the whole story, the coronavirus started somewhere along March 12th or thereabouts. Then it peaked around April 2nd. The lockdown was only introduced on March 22nd, when they were already seeing 5,000 new cases per day. So if the lockdown had been earlier, we could have probably seen a flatter curve. That's just a hypothesis. That is not a fact. Anyway, the fact is we are seeing a nice sort of steeped bell-shaped curve, which is not what you expect to see in a lockdown situation where we are trying to flatten the curve. The New York bell curve shows peaking at about 10,000 cases per day about April 2nd, and from there it has shown a gradual decline towards less than 1,000 cases per day, except for these 2 days. So New York City has done a tremendous job in bringing down the number of active cases in the city. And similarly, the death rates also show a similar pattern of reaching a peak approximately about a week after the beginning of the corona cases, and it is slowly and definitely gradually going down, and now the death rates are less than 100 per day in the New York City area. And this is Massachusetts, except for this one particular day, which is April 24th, where they had 5,000 cases per day. This curve looks much flatter because the maximum number of cases they encountered was like 3,000. And this is a much flatter curve, and also it is showing a steady decline since April 23rd. We see a similar pattern in new deaths in Massachusetts, where it peaked around April 23rd, and from there it has shown a steady decline in the number of deaths in the state of Massachusetts. Now let's move on to Texas, which is showing increasing number of cases. Texas has 54,348 cases of active coronavirus infection. It has accounted for only 1,500 deaths compared to 29,000 deaths in the state of New York. More than 32,000 people have recovered in the state of Texas. And here is a graph which looks more like a flattened curve, which is what we expect to achieve in a pandemic. So our healthcare resources are not stressed to the max, so that we do not run out of hospital beds, intensive care units, or respirators or ventilators. In fact, in that respect, Texas has done exceedingly well in containing the number of cases, reducing the number of active patients in the intensive care unit, reducing the mortality, and at the same time flattening the curve. One of the important things I want to let you know is on April 29th, Texas opened up certain businesses. So there might have been a slight increase in the peaks here, but one thing that we have to keep in mind is the curve is not going down as we expect, as we saw in case of New York, in case of Massachusetts. So we had 2 days of a sudden spike here in the number of cases, but it is nowhere compared to what was seen in the New York City. So in Texas, we have flattening of the curve and a prolonged flat top in Texas. Now, on May 26th, Texas is going to be opening up for more businesses, and it will be important to watch for the next couple of weeks as to what is going to happen in Texas as far as the number of new cases and number of deaths. And here is a chart showing daily deaths, and as you can see, it is all over the place, but nonetheless, the numbers are significantly lower compared to what we saw in New York City or New York State. Similarly, here are some of the hot spots in Texas, namely Houston, Fort Bend County, Dallas and the surrounding areas, Austin, San Antonio, in fact, Lubbock, Amarillo, all these are hot spots. And at this time, Texas has performed more than 834 plus coronavirus tests, of which 53,500 cases have turned out to be positive, which is approximately like 5 to 7% of the number of people tested. Whereas in New York City, it was more like 8 to 9% of the people who were tested showing evidence of coronavirus. This is what we expect to see by flattening the curve. What we are trying to do is we are trying to reach a level which is below the healthcare capacity so that the healthcare industry and the medical professionals won't be overwhelmed with the number of cases they cannot handle. And that was to an extent in case of New York, where it came from nowhere and they had absolutely no time to prepare. And there are certain other factors in New York City, like the population density and the small areas in which large number of peoples are living, and also sharing common areas like elevators, hallways, passages, which accounted for a much higher incidence of coronavirus new cases and also deaths. And here are the daily new cases. As you can see, it has not started to come down altogether. In fact, just yesterday, there was a spike where it reached almost 1,800 new cases. How do we overcome this corona crisis? Well, I tell you what, we can't run, hide, or be cavalier about it. There is no safe place as far as coronavirus spread is concerned. Only you can protect yourself. And you know the drill. Face masks in public, 6 feet safe distance, frequent hand washing with simple soap. So these are some of the things we need to continue to do, no matter whether we are on a lockdown situation or whether we return to our workplaces. Of course, when we return to our workplaces, there are going to be more people who are going to be tested for coronavirus, and there may be a jump in the number of new cases, but the most important number to follow would be the number of hospital patients at any given time. The number of patients in the hospital in Texas is around 1,800 cases, and it has been sort of flat for the last 2 weeks. Hopefully, we can begin to see some downtrend in that, and that's an important number to watch. The next question is, how long do we keep doing this? Well, let me tell you, your guess is as good as that of all the medical experts in the world put together, including my 2 cents. Well, how long do we keep doing this? I say until the virus mysteriously disappears somehow. But I don't think that's going to happen, knowing the fact that just yesterday and today we had more than 100,000 new cases all across the globe. Until we have a drug that can kill or slow the virus, there are a couple of drugs that are in the market under research, which has been shown to reduce the viral load. but that drug remdesivir, which is not available to everybody in the community. Of course, when we have a vaccine that can provide immunity, that's when we can feel safe that we have overcome the virus. There are at least studies here in the United States, in UK, and also in Germany, where they are testing the vaccines in phase 2 and hope to have a vaccine available towards the end of this year. Mark that word, towards the end of this year. When we are talking about towards the end of this year, that means we have to go through the summer, we have to go through the fall, and we also have to live through the flu season before we can see the daylight as far as the corona vaccine is concerned. Virus mysteriously disappearing, which doesn't seem like, if you look at the number of new cases all across the globe, which I already emphasized. In the last 2 days, it has been over 100,000 cases per day. Okay, the next point is we talk about the second homecoming. I call this the second homecoming of Corona Queen. Is this going to happen? The question is just a matter of time. Historically, if you look at the pandemics, they have had 2 or 3 cycles of the same virus or modifications of the same virus circling through the world. And here is a perfect example of 3 cycles of a pandemic of Spanish flu in the year 1918 and 1919. That's more than 100 years ago. The first pandemic lasted for only a month or a month and a half. And after that, there was almost a couple of months break. And then it came back with vengeance. And it was almost like 5 times bigger than the first one. Third wave, which also came, the whole pandemic lasted for 10 to 12 months. This is not the only example. There are other examples of pandemics which have a tendency to come back for the second time or maybe even for the third time. Here's another example of the swine flu that was recorded in 2008 and 2009. And again, we can see we had 3 spikes of this swine flu before it eventually disappeared from the scene. So here are some of the concerns as we go forward. Number 1, we will be approaching fall when the flu season begins. So the second wave of the coronavirus, we don't know when it's going to happen, but if you look at some of the more recent reports from China, where they have seen the early signs of coronavirus second wave with new cases detected in cities other than Wuhan, they are planning to, or they have already locked down 100 million people. So the second wave of coronavirus is just a matter of time. In the United States, we still have states which are still going through the first cycle of the coronavirus. So we should not let our guards down. We should continue to practice our self-mitigation. It doesn't matter whether we are in a lockdown situation or whether we are returning to work. The conditions remain the same. The atmosphere remains the same for anyone to get infected. The best thing we can do to ourselves is to continue the self-mitigation principles that have been laid down until we have a coronavirus vaccination. Ladies and gentlemen, I am Dr. Nik Nikam, and this has been a COVID-19 World News Update, and this is May 22, 2020. Thank you so much for watching this presentation. Please do like our YouTube channel, and please do subscribe to our YouTube channel and share this information with your friends and associates. Thank you so much.